Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where healthcare workers come to be seen and heard. And today I have Dr. Sheila Patel with us. What a wonderful guest. Thank you so much for joining us. Dr. Patel is family medicine trained and she's been practicing medicine for 30 years. She has been the chief medical officer with Chopra Global. And now you're doing primary care by day and also doing Ayurvedic teaching as well. So you've got a full plate. Tell us a little bit about your schedule.
Yeah, thanks. And thanks for having me. Really appreciate the conversation. Yeah, it's been interesting. I never would have guessed, 30 years ago that I'm doing what I am doing now. We go into medicine, we kind of have this path and then, one day you wake up and you're like, huh, is this what I really want to be doing? And I love primary care, but I've also uh learned over the first half of my career, I was doing full spectrum family medicine and I loved it and I love primary care. But medicine has changed a lot in the last 30 years. And also the way I learned, what we knew in medicine at that time, I found that I only had a few tools in my toolkit, right? And so I came to a realization, and we can dive into my story, but that there was more to healing and there were more tools out there that I didn't know about. And so I have a naturally open and curious mind. So that instigated this move toward, how did people used to heal? And, I grew up here, but my parents came from India, in the 60s, and they brought with them a lot of great traditions that we practice in our home. And some of the things my mom would do when we got sick or how she cooked in the kitchen, I knew were from Ayurveda, which is a traditional healing system from India that's thousands of years old. And so I thought it was like home remedies and things like that. But as I made this shift, I thought, well, let me learn more about this traditional healing system. It was a whole medical system, and there were Ayurvedic doctors. And so as I started diving deeper, I realized, oh, this is a whole system of medicine that has a more complex paradigm than I learned of who we are and how we heal and all of the tools that are available to us, especially within our own bodies and within our kitchens. And so that fascinated me. And, as we would say in some of my Ayurvedic circles, once you drink the Kool-Aid, you want more. So once I started learning this more expansive paradigm, and honestly, it gave me so many answers with all these patients I had over the years that I was like, I don't know what's going on with them. But I was like, oh, from this more expansive paradigm, now I see exactly what was going on with them. And it just made me want to learn more and more. So that's kind of the short story, but I just now try to blend the best of what we offer in Western medicine, which is absolutely, I still prescribe meds and appreciate all of the things. You can't go through medicine without appreciating all the miraculous things we can do, but you also probably can't go through medicine without realizing there's a lot we aren't doing well. And so that's where I've started integrating Ayurvedic lifestyle, because that's what Ayurveda was about, is how can people do things on a daily basis to keep themselves healthy. And that's what we're finding out now about with lifestyle medicine and all of these things. So I try to integrate all of that, but really using this paradigm that comes from Ayurveda.
Do you feel like it's difficult? Do you feel like you're stepping in one world in another, or do you feel like you're flowing
I really have
back and
made it a
forth?
flow. Yeah, I mean, that's a great question because I don't think it has to be one or the other. Like, we don't have to be in silos. And unfortunately, integrative medicine is currently, I mean, I think it's evolving, which is a whole nother bucket of, like how to think about medicine. It's like a department or a specialty as opposed to like what it really should be is a true integration. So that's what I've tried to do with Ayurveda, is integrate it into what I do so that, and it's very interesting. It depends on the population that I'm seeing. If I'm in my primary care office and I'm seeing someone who knows nothing about Ayurveda or, you know, this sort of new different paradigm, and they maybe are just coming for medication, I introduce it in little, I plant little seeds. For example, in Ayurveda, they have this huge science of food as medicine that's been known for thousands of years. And there are different mind body types or phenotypes. We know that, there are different people will respond to different things. There's not one size that fits all. And now I can kind of assess someone's, mind body constitution when I meet with them and talk to them and get their story. You see these patterns emerge. So when people have a lot of irritable bowel syndrome or gas or bloating, I'll say, oh, hey, why don't you try like cook all your food, eat it warm and cooked, and use these spices. And I'll give them, some recommendations, and put that in your food, or have some ginger or whatever. Pretty simple things that we can recommend in Ayurveda. And then they'll come back and say, oh, I feel a lot better. And then I say, oh, well, that comes from this traditional healing system. Maybe, would you like to learn more? So I kind of integrated in. A lot of people are coming to me and they say, I don't want to take medicine. And granted, sometimes you make a good clinical, you use good clinical judgment. And you say, okay, well, let's try to use other things first. Food. I know I've learned a lot about Ayurvedic herbs, supplements as well. I've kind of done additional trainings to learn all these things. But in certain people, I would say, hey, I get it, I know, and you probably, let's start you on medication and get you out of the danger zone. And then we can talk about, bridging you off if it's reasonable, or hey, let's get control of this and use meds, but let's have a plan for 3 to 6 months from now to wean you off using all these other tools. And that's what most medications were designed for, 3, 6 months, like they weren't really necessarily supposed to be forever, but that's, and that's why we see a lot of the side effects and issues that we're seeing now. I remember in residency, I went into residency in 1994, and it was just the peak of pharmaceuticals, like a pill for every ill, right? Like Paxil and Prozac, they were all still brand names. And the first statin came out, branded, and the very first PPI, and so then you look at these graphs and it's like, whoo, exponential drug development, and we aren't really any healthier, all these decades later. So yeah, so anyway, it's I really, really try to integrate and kind of walk the middle path, as we say. There are times we need medications and tests and procedures, and there are times when we can easily manage things without.
Do you feel like there was anything in particular in your practice as you're going along and doing conventional medicine that really kind of stuck out to you, that you found that traditional medicine just wasn't answering the questions and you had almost like an aha, like there's got to be something more here?
Yeah, a couple of things stick out in my mind. So this was probably about 10 years into doing primary care, and I did full spectrum primary care, and in small communities. So for the first 4 years, I was in Southeast Alaska on a tiny island. And so I really got to know my patients well and their families, and we delivered their babies, and we had a little long-term care section. So we would actually transition people also. So it was really the birth to death model, did all the prenatal care, et cetera. And then the next 8 years after I left Alaska was in Southwest Wisconsin. I'm from Wisconsin, so I went back, and uh, it was a wonderful community hospital, and where the doctors did have some autonomy. And we did the same thing. We were doing OB and doing also managing. We all did call in the ER and took care of our patients when they were in the hospital. So you really get this full picture of what's going on with somebody. And so what happened was a couple of aha moments. One day I was sitting there with a patient as their primary care doctor. So we would see people in the ER, we would get them out of trouble, maybe admit them, get them all spiffed up, and then revolving door, right? They would come back. Like I remember many like of our cardiac patients, LDL was 70 and they came in having another heart attack, and you're all scratching your head. What? They're on all the right meds. What's going on here, And so he came back to my office and he said, Doc, why did that happen? How can I prevent going into the hospital again? And I was like, I mean, I'm doing everything I'm supposed to do. And I realized I don't know. And, as doctors, it's like, I don't want to say I don't know. That was not okay. So I thought, well, I got to find more answers. And then So that was one thing I started really looking into, like, how do we prevent disease? I'm not really preventing disease. What are we doing, you know? And the second one was a couple of patients. This was the time where people were reading more and magazines were coming out, and the first people writing about uh, mind body medicine and messenger molecules, and like, the biology of belief and, perfect health. And, all of these kind of books were coming out, and even the first, like, how important food is for health.
Yeah.
And so patients were reading these things and they were bringing them to me. And not just that, but like healing touch. And I remember someone brought me a magazine. There was some magazine that was selling magnets and they showed it to me. They're like, Doc, do you think this could help me with, because it was pain or something that we were treating horribly? We don't know, we still aren't doing a great job treating pain. But they said, do you think this could help me? And instead of being someone who's like, "Oh, no, there's nothing to it because I don't understand it. There must be nothing to it." Um, I said, "Well, let me look into it," And so more and more people just kept asking, "Well, should I take this? Should I take this?" So that those things were the instigators for me. Like, I really want to understand. As their doctor, they're coming to me. I should really understand what's going on, and I wanted to learn why the things we were doing that were supposed to be keeping people out of trouble, that revolving door was happening. And I'll tell you, it's really interesting because being in that setting that I don't think many people are in anymore, myself included, but I did that for 15 years. And so I would see people as a primary care doc. I would take care of them in the hospital or the ER or whatever, and they would come back to me. And sometimes I would send them to a specialist, but it was a really great primary care model. So, uh, but things are so siloed now. And so and they would come to me and tell me if they were doing something like supplements or this or that, or doc, I started doing this and I feel so much better. Whereas now I think there are specialists, like I'll send people to a rheumatologist or wherever, dermatologist or endocrinologist, and they won't get good answers, or they'll say, like, there's nothing wrong with you. I don't, just, or they'll say, here, take this medication, and patients are like, "Oh, I don't want to take that strong, immunosuppressant." And so they'll come back to me or they'll try other things. And actually all the years I worked at the Chopra Center, those are all the people that we would see as people who'd stepped out of the Western medical model and healed themselves. So you see story after story after story, and you start to understand, oh, there are other ways to heal. Where that specialist who had just said, here, take this medicine, never saw that person back again, out of sight, out of mind. You don't realize all those people healed doing something else. You just end up seeing the same people that are healing from the medicines we're giving them, because some people that works for, right? So my point is that we're so siloed that people in the medical world don't realize, unless they hear the people's stories and believe them, that they're healing doing all these other things. And vice versa. There are people, and this is why I love being on kind of both sides of it. There are people in the kind of natural healing world that don't see the people who get sick when they don't perhaps take medicine when they really should. And so then they don't see them back. So it's like when what you don't see, you don't know. And so I really appreciated being able to see everyone's, story. And I think that's really important to start sharing. And I've been encouraging people that I know, like, share your story, because, you know, doctors need to know what people are doing to heal.
Well, I think it's gotten, like you said, more siloed because similarly, when I started practice too, all of primary care was one long flow, and certainly it was a tremendous demand on the interest because you had to round in the morning, you had to do your clinic, you had to manage people in the ER, and then
Yeah.
round in the evening. And so it was tremendous. So, now we have hospitalists and they're taking care
Right.
of it. And then, you've got the clinic, but the problem is that you don't have that communication going from clinic to the ER to the hospitalist back to the clinic in real
Right.
time. And sometimes, patients don't even necessarily get follow up. Sometimes patients are seen through the ER and hospital and then are lost to follow up because they don't necessarily have a team that they're working with. So
Yeah. Yeah.
I feel like we have so many people talking about outcomes with no follow up. And
Absolutely.
I think your point's very well taken of having patients and clients talk about their experience and going back to the physicians to give them some follow-up of like, by the way, I did or did not take your advice, and
Right.
this was the outcome of it. So that I think a lot of people don't realize that we are learning all different types of trends because medicine is it's this huge flowing ever changing kind of organism, and we're always responding to it, and what may have worked last year may not work for this year because
Exactly.
there's something changing, so we have to evolve with that too. And certainly patient feedback is tremendous and very impactful. I know that sometimes at least for me in surgery, when something comes up and I try something new, I think my patients get really irritated because I see them back way more than I normally would because I'm trying to retrace of like, okay, what is the effect? Was there an effect? Did this do what I was hoping it would?
Yeah.
And I think that's something that in many cases, because medicine is getting so compartmentalized, that we're kind of losing that feedback. So
Absolutely.
I
Yeah.
think that when physicians hear the term Ayurveda, I feel like they think it's not everybody, but some people might think it's unscientific
Yeah.
or it's, alternative medicine. How do you describe it to physicians?
Yeah. So, it is interesting. Like, when people say like, what is Ayurveda? Well, it's kind of like saying like, what's Western medicine? It's a paradigm for, for healing. So I always tell people Ayurveda is really, it's a traditional medical system. And it's really the original, I like to say the original lifestyle medicine. So like, who can argue with that, right? I mean, Ayurveda, because I think a lot of times when you say, oh, it's unscientific, it's like, what part of it are you saying is unscientific? You can't just say like that's unscientific. Like what about Ayurveda do you find unscientific, right? And I think because we don't know, it doesn't mean there's no science, right? I think doctors we get into these little like we n- we put ourselves in these narrow lanes. Like if I haven't heard about it, there must be no science, right? Or I went to this conference and learned all about this thing, and they said there's like limited science. But I think we have to expand, like, what do you mean? Like there wasn't a randomized controlled trial, or that there's no biomolecular science that shows like, oh, there is some validity to putting oil on your skin or oil pulling, like how it changes the microbiome and how it you know helps your saliva secrete more saliva, and moving the muscles on your face communicates with your vagus nerve to like induce a parasympathetic response, and so
We
like
think we're driven by literature, right? And it's like, well,
yeah,
the literature says,
yeah, but
the
right,
literature. And
and
it's
that's
like,
yeah, exactly,
if
like
it's not in the literature,
the
then it can't even exist.
right. And so
Like, so
then I
no
say,
progress.
so that's what I ask people is like, so Ayurveda is based on this concept that our physiology is constantly changing and the choices that we make will affect that biology. Okay, that's not okay, that seems reasonable, and that disease starts in the gut. Oh, okay, now we do realize that. And so, Ayurveda, a lot of Ayurveda is based on, food and healing the gut. And so hard to argue with that. A lot of the herbs that we use like have a lot of data, a lot of science that show that they modulate the microbiome. The spices are hugely anti-inflammatory and antioxidant molecules. They have epigenetic effects, where they turn down inflammatory genes. So again, if someone says there's no science, it's like, well, let's talk, because there's a lot of science that shows how these traditional practices really help people create a healthy lifestyle that does reduce inflammation, which we know is involved in most chronic disease, that does help to balance the sympathetic overarousal that seems to be epidemic, which honestly is the cause of a lot of issues that we have, this sympathetic kind of overarousal. Constant fight or flight, and that affects the brain, it affects the immune system, it affects the gut, so a lot of these practices are impacting the nervous system and, balancing that. So we're getting to the root cause. So that's the other thing I tell people is a lot of these Ayurvedic practices are helping treat the root cause. And doing it in a personalized way. So Ayurveda has this very unique concept of different mind body types. And that was hugely useful to me when I first learned about it, to understand myself and to understand why in medicine I could do the same thing to 10 different people and they would each have a different response. Well, that wasn't supposed to happen, you know? And so that it really, once I learned about these different mind body types, and all it is talking about how all of our different, very unique genetic, patterns show up in phenotypes, and so they're going to respond differently. And that was life changing for me. So I'll tell you a story. When I was a resident, this was before I knew anything about mind body types or Ayurveda. And I was doing an ortho clinic, ortho rotation. And I went in, did the whole history on the patient coming in for a knee replacement, or she was, probably needing a knee replacement. And then, you go back and you tell your attending the story. And so I went back and I gave the story and, you give all the vital signs. And she was overweight. And then I reported back, this is her diet, blah, blah. And you'll understand this. The attending right away was like, patients always lie to us. You look at her, she's got to be eating 3,000 calories a day and, blah, blah, blah. And that really stuck with me. And this is why, I'm sharing this because it stuck with me because what the patient was telling me was my lived experience because I'm a kapha type, what we call kapha type, and that means, we tend to be, uh, in Ayurvedic terminology, we say earth and water type. So people who might gain weight easier, lose it, harder to lose it, go into more anabolic states under stress, right? Can eat very little, but still gain weight. And so this is what my patient had told me. She's like, I mean, I don't eat that much. And I'm still like, it's real, I can't lose weight. And now we understand that it's so much more than calories in and calories out, right? It's all of these satiety hormones and GLPs and our microbiome and how much are we producing. And so that stuck with me because like what he was saying, I'm like, I didn't speak out, of course I was a resident, I wasn't going to say anything, but I remember thinking, but I know what she's saying. I think she's telling the truth because that's my experience, like I don't eat that much and I see other people eat way more, but I couldn't make sense of why are they not gaining weight and I would if I ate as much as they did, So again, all these little things that I started seeing in my practice, and Ayurveda gives in a different language um, explanations for why different people experience life differently, and that it just resonated with me so much, and it's really panned out to make a lot of sense for me when I see patients. So yeah, so I guess in a long answer to your question, I mean, there's so much science to support these principles, and in most indigenous and traditional healing systems, and especially if you expand your paradigm into emotional health, mental health, and spiritual health, now we're really understanding a lot of the benefits. And in Ayurveda, you would never just treat a body. You're treating a body, a mind, and a spirit. And that really has helped me in many situations with patients, when perhaps it's their mental health that's driving their physical issues, or lack of connection, lack of purpose and meaning is what's driving their mental health, as opposed to, oh, you have a neurotransmitter deficiency. No, that's not it. So yeah.
Do you feel like that you are listening to patients differently than
Yes,
you used to?
absolutely. Yes. So 100% we need to listen to our patients, right? And they will tell us what's going on if you're listening closely enough and if you know what you're listening for. So again, even if I'm seeing someone in a regular primary care setting and I'm not going into Ayurveda, when they start talking to me about their symptoms, in my mind, I'm categorizing them into, you know, which of these sort of principles in the body, these mind body principles, is out of balance. And as they're talking, I'm like, okay, nutrition, movement, sleep, emotions, where's the root cause? Because for each person, the root cause will be different. 3 people will have hypertension. One person, maybe it is salt in diet. One person, maybe it is lack of movement. Another person, it's going to be their nervous system and sympathetic overarousal and interrupting their sleep and all of those things, right? So I'm listening for their pattern, is what I would say. Yeah. And that helps me guide them. So instead of throwing, like a diuretic or telling someone, oh, eat less salt, I'm going to address their nervous system because I realize that's what's driving your hypertension, you know? Yeah.
So I think one of the things that we in Western medicine are typically focused on is symptoms, and everything is symptom driven. Do you feel like Ayurveda interprets those symptoms differently? Or do you think it's
No,
a bigger breadth of it?
yeah. I mean, I would say, yes, a bigger breath in the sense, you're listening to symptoms, but instead of thinking, how can I treat that symptom? You're thinking, what's creating that symptom and how can I treat that? So it's a little maybe nuanced, and some people might say, well, I do that, but it's given me a wider breadth of asking what's causing that as opposed to a biochemical issue or just, and the lifestyle medicine's great, but sometimes it's like, oh, what are they eating? And they're not exercising enough. But there's much more to our physiology than just those things. So I feel like you're still listening for symptoms, but instead of just treating the symptom, you're trying to figure out what's causing that symptom and how to best treat it in that person. And that's again also with a bigger toolbox, a bigger toolkit. I feel like I have now.
Do you feel like there's any particular conditions that you really have to stay more Western medicine versus that Ayurveda may or may not have as much effect as say traditional Western medicine?
So, obviously if someone is needing ICU care or is in an accident and by the way, there were surgeons thousands of years ago. One of the primary Ayurvedic physicians, Shusruta, was a surgeon and did all kinds of surgeries. This is thousands of years ago. So it's not that there wasn't a recognition that there's a time for that. But, and obviously ICU care and all of these things that we can do with modern medicine are amazing. Uh, I will say the farther along someone is in a disease process, like if they're showing end organ like failure or um, not failure necessarily, but like they're really needing more support, medication is going to make a change much more quickly. Uh, Even in Ayurveda, though, the philosophy in the medical system, there's 6 stages of disease, and you're always trying to catch things early. So you're listening for symptoms instead of, like sometimes people, you can do labs on people and imaging and say, well, everything looks okay, the labs look okay. You don't fall under any diagnosis, so you're fine. But in Ayurveda, you would never do that. You would say, okay, well, there's something going on with these, that's creating these symptoms. Because when we're in good health, we don't have those symptoms, right?
Right.
And so you're always trying to prevent the progression of disease. And so, now when we're like, oh, now diabetes shows up, pre-diabetes, there are changes happening 10 years before we're diagnosed. Well, Ayurveda knew that, like things don't just show up overnight unless, again, you're in an accident or something. But so in Ayurveda, when things are affecting that organ and it can't function properly, it's really hard to reverse. I mean, this was said thousands of years ago. So there are really great treatments for, advanced diseases, but there's an acknowledgement it's harder to reverse that if you let the disease go too far, right? And so in those situations, in answer to your question, I do tell people, just take this medication for a while. We have to get your immune system under some control because it's out of control right now. Once that's under control, let's talk about, potentially weaning you down by implementing all of these other things. One thing I found in medicine when we say the natural course of this disease, we don't finish the sentence. The natural course of this disease is XYZ if you don't make changes to your lifestyle. That's the end of the sentence, right? For most things, 90% of things. So when I see people who are on medications or we start medications, once things are under more acute control, then you say, okay, what can we do? Let's look for how you got here. What can you change with your lifestyle, your food, your movement, your sleep, get your sleep regulated. I mean, now we know how important sleep is. And, again, Ayurveda has all these teachings about how important sleep is so that we can maybe wean you down off your medications and think of this as a temporary thing. Um, again, certain genetic predispositions are very strong and someone might need to stay on medication and that's fine. It's not, a bad thing, but there are times when, of course, when we need medication, but then always wondering, is this someone who, has there really been enough damage that that organ isn't going to function well without this medication, or are there things we can do to get that function back? And oftentimes there are.
I know that for me personally in my practice, we have surgery, dealing with cancer is such a broad spectrum of treatments. And we often combine Eastern and Western traditions together.
Yeah.
And it's very interesting that I do find that in our patients, people who just go either hardcore in one direction or the other seem to be
Yeah.
missing out on a tremendous benefit. And the journey for people who really take on both strategies,
Hmm.
I feel like that journey is a very different journey for those patients.
100%. And that's one of those categories where it's so helpful to, use both. Yeah. And again, it doesn't have to be either or. Chemotherapy or surgery or whatever's needed is extremely useful. And, a decade ago, there were all these studies coming out on yoga and meditation and, um, for especially women with breast cancer, improving quality of life and sleep after their acute treatment. So yeah, okay, cancer, no evidence of disease now. You're great. Let's see you every 6 months or once a year. But their physiology, and this is where Ayurveda is really helpful, and other Eastern, um, traditional systems of medicine to get you back to balance. So now how do we get that immune system that's been really activated to, how do we modulate that and get that back to balance? How do we get your sleep back to balance? How do we address your emotions, right? And maybe even spiritual well-being. And so there were studies that showed that women had better quality of life, less inflammatory markers, if they started doing some, change their nutrition, started doing mind body practices. And we know also molecularly if that inflammation and having chronic inflammation is a matrix that increases the risk of recurrence and metastases. So of course we want to reduce, chronic inflammation. So yeah, so there's a really nice way to blend all of these things. I'll
I,
tell you another story just because we're talking about cancer. I did do a talk because I teach meditation as well. And I did a talk for my alma mater. I did it virtually, and they have an integrative oncology department, and they were doing grand rounds and for their cancer, the oncology department, and the integrative oncology people, you know, would do some of those grand rounds. And someone had reached out to me, and because they knew I was, doing meditation at least and other things. And they asked, hey, can you do a lecture on meditation and the benefits, for cancer patients? So I did, and it was honestly quite evidence-based because there's a lot of evidence on meditation and, reducing inflammation and, epigenetics and all of these things, and helping with DNA repair genes and all of these innate mechanisms that we have, right? And in the chat, there were all these things, people were commenting, and there was one person that commented, traditional systems didn't work. That's why we have modern medicine. I was like, are you three? Like, what do you mean? And I mean, we didn't address that in the Q&A because I was like, what does that even mean? I think we have to check ourselves too as doctors when we hear about something like, where is that strong emotion coming from, and I was just talking about meditation. It's pretty benign practice. So I found that really funny, and I thought, wow, you're seeing patients, and like if they ask you about meditation, what are you telling them, Yeah.
yeah. So I feel like if you're having this conversation with your patients, your, I would suspect your patient physician relationship is very different than many people practicing right now. And there's a time component that I think is really involved here too, because
Yeah.
I think, especially in primary care, I mean, there's
Oh my gosh.
such short time. Tell me about your relationships with your patients, because it seems like it's got to be so different.
100%, 100%. I love my patients, and never have said to a patient, we can only address one thing today, you'll have to come back. So I usually run a little late, but people are totally fine with it because number one, when I walk in, I say thank you for waiting. And number two, they know when I walk in the room, they are the only person in the world to me, and so they know that's what I just did with the other person, and they know they're going to get their things addressed. Now, luckily, I can do that because I work at my friend's practice. She's a solo practitioner, and she still has numbers to meet. So we have 20-minute visits and 30-minute physicals, which I know is longer than a lot of the people I know that work in big systems here have. Uh, and I've just chosen to do that. I could never work for a big system that said you have 7 minutes or 10 minutes for a visit. I would say I can't do that. I can't address properly. And I think that's what's being asked of doctors, and that's why they're burned out. They are thinking about retiring. When can I retire? You don't get as much satisfaction. I mean, I love being a physician, and when I was doing this in smaller towns, we were friends with, I'm not, I mean, there was a very professional relationship, but it was friendly, right? And we knew our patients, and we had at that time, this was again 20 years ago, we had a little more autonomy. We fought for 40-minute physicals and, depending on the issue, 20 or 30-minute visits. And when I was doing integrative Ayurveda consultations at the center, we would spend an hour with each patient. So time definitely is makes a difference, but so does presence, and I think even if there are times when 20 minutes, 30 minutes go by, and I recognize I have, an afternoon of patients. Uh, but if you're present with someone and you're listening to them and they feel heard, oftentimes I'll say, "Hey, let's start with this, and then I want to see you back again in 2 or 3 weeks." And luckily I can do that, because we have the time to do that with patients, see them back again. It's not like, here, take this medicine and see me in 3 months. uh, and they're usually fine if I have to cut the visit, because I've listened to them. And we've lost the art of medicine. I had a patient come in several years ago, and she had a lot of like a lot of medical issues, and I listened and I was empathetic. And there are plenty of studies out there. People can look them up on empathy and how just listening to somebody and empathizing, just saying one sentence of empathy, actually their immune system does better. Like, we have these connections where we can help patients just by listening to them. And we stood up, and at the end of the visit, I was like, I feel like, I didn't really do anything. And she was like, oh my gosh, I feel so much better than when I first walked in. No, that was so helpful. And people just want to be heard. And we had a plan, and so they want to know that there's a plan. And, I think we underestimate how much healing can be done just by being present with someone, you know? And so I love that. I love that part of, and I love primary care. And so I still do it. But I don't think I could do it if I was working for a big, huge organization. And, when I take my dad to his visits, he is a lovely doctor. He's very kind, but he doesn't know anything about my dad. Like, he walks in and he's very kind and nice and does what he needs to do. And nowadays, doctors barely put their hands on people anymore, and refills his meds. And because he takes good care of himself, so he doesn't have a lot of issues. And we see him once a year, and that's about it. And it's so different, from even the patients I only see once a year. I know them quite in depth. And my dad, actually, he recognized medicine was changing. And I remember when I was growing up, he was fairly healthy, but he would see his doctor and he would listen. This was, back in the day. And he thought of his doctor as his friend, and I don't know, that's just such an important part of, and again, even as a specialist, like, just, we don't have to all have that. I think in primary care, it's important to build that trust, but just listen to the patient. And, I think so many, be present with them, and, I think it really helps us to stay in medicine and, like, have less burnout.
Well, that's kind of what I was thinking. Burnout in medicine is so high. And listening to you talk, you sound nothing like a burnt out physician. So, what is it that you think integrative medicine and Ayurveda offer
Mhm.
to physicians?
Yeah, I think that's a great question, and, I think part of it is just a different way of relating to the patient, you're, and most integrative docs that I know, and in Ayurveda, you learn you're thinking about each person as a pattern of nature. You're a manifestation of nature. We are nature. And so we respect that, how nature is functioning through this human. And our job is also to stay in balance. So during Ayurvedic training, people are expected, they meditate, they're expected to take care of themselves. And again, inherently, when you think about the bigger picture, because in Ayurveda, we are connected to everything in the universe, and so we are all of that. And we are just these kind of human mind bodies that have nature functioning through us in a very unique way, right? And I think when you think about people that way, you can't help but have a respect for humans and human physiology and nature and all of those things, and you feel connected to you feel more connected to people. And I think connection, as we're learning, is so good for our mental health. I think if you just look at someone as a diagnosis, or as again, as we often say, transactional thing, like they're here, they have a problem here, this is what you do, and you don't really connect to people. uh, it's the same thing that happens in relationships. When you don't feel connected, we get depressed, we get sad, we don't feel fulfilled. And so it's no wonder we don't really teach that, how to connect to a patient. And you always touch someone, like in Ayurveda, you would check a pulse. It's one of the diagnostics that you do. You touch people, and you can do things virtually as well, but you're listening. So in Ayurveda, we you look, you observe,
Look right in the eye.
yeah, you observe the person, you look them in the eye, not at the computer. You listen and you touch, and that's how you get information, and that's how you connect to people. And yeah, and in integrative medicine too, I think, I just came back from a great conference where people are just really starting to understand, maybe not in the conventional medical world yet, but how complex our human physiology is, and that most issues are multifactorial. There's not going to be one medicine or one thing that solves, all of these issues that we're seeing. And, to really appreciate the sophistication and of what's going on in somebody, I think that's the way of the future. We have to start understanding ourselves as more complex than just the way we're you know linearly and in a reductionist way treating diagnoses. It's just not working.
I feel like that's true in the physician patient relationship, but I think also taking and flipping that back on ourselves of like our own relationship. And, I always like to say we're human beings, not human doings. And it feels like you have a tremendous amount of meaning in what you do. And
Yeah.
I think the more transactional that medicine has become, and especially in the silos, and I'm only in this lane and I've got you for 5 minutes here and then on to the next person. It's almost like, the cafeteria line where you're just passing and you're getting this and then this and then this and then this. And it's multiple people with little snippets.
Y-
It's hard to have meaning in what you do and feeling like you can impact people.
Well, and I think because we're starting to see, oh gosh, these people aren't getting better. I gave them the medicine that I know, that's very unsatisfying when you're like, I don't know what to do next. So, okay, well, there are a lot of things we can do, so we have to start breaking through those barriers of, just one way of treating people. Absolutely, and bring meaning and purpose and connection, empathy, all of those things, back into medicine. And I'll tell you, it's not, the doctor's fault, and I've talked to a lot of people over the years about physician wellness programs, and hey, can you come and teach breathing practices and meditation? And there's some pushback on that, and I agree with it, because it's not just the physicians, oh, you need to go take better care of yourself. The system has to change for us. You can't expect people to do the things we need to do within a visit, if you have to see 30 people. If doctors aren't valued, then it's hard to feel good about what you're doing every day. So many things have to change at a systems level too, to really cure this burnout problem. Yeah.
Well, I think that autonomy is something that we've lost quite a bit over the last several years. And I think the point you make is very well taken about, being respected and the system respecting us
Yeah.
and really acknowledging that we know what we're doing and that we know that we can't necessarily do a good job in 5 minutes or 7 minutes with a very
Hmm.
complex issue. And so that autonomy that the system takes away, I don't know how we're supposed to treat burnout in a non-systemic way because I just know in our community we've had 3 physician suicides in the last year.
Oh my
And
goodness.
if I get told one more time that you just need to take a hot bath or go
Yeah,
meditate,
right.
and I meditate every day,
Hmm.
and that still hasn't changed all of the systemic issues which are causing a lot of the difficulties that we experience and certainly that patients are experiencing regularly.
100%. Yeah, and I don't think I would still be, so thrilled to do what I do if I hadn't stepped out. Unfortunately, and people can criticize that, but that's why also, I mean, I still want to see patients in primary care because I want to help patients, like sometimes I introduce things to people and they're like, "Oh my God, I've never had a doctor ask me that," or "I've never had a doctor suggest I do that," and they love it. Uh, but also for myself, I see patients in the office 1 day a week and, I'm doing other things, but teaching and all those other things, but I've had to change because the system it's hard to, system doesn't necessarily support physicians, as we all know. And I will add, part of again having this more expanded vision of health and how we heal, it's given me more hope for patients. It's given me more ways to help people. I've actually seen more and more people get better, which again, if you go to work every day and you don't see people getting better, it's pretty aggravating, frustrating. So when you start seeing people get better, then you feel like, oh, I'm really helping someone, which is why people go into medicine. I fully believe that. So I do think education, and I know many people, who are trying to push for really bringing in other paradigms and other more open thinking in medical education. We have to, I mean, bring the science along with it. But for somebody to say there's no science, that means they just haven't seen it, or they haven't had somebody present it in a way that they can you know, that, um, that explains some of the benefits of all of these practices because it's there. Again, it's not always going to be a randomized control trial, but even how we study things and what we think is evidence, we need to learn there's other ways, to do things and to learn things and to know things and to integrate into patient care without having a randomized control trial. We literally can't on every single thing.
Well, like you said, in measure, but maybe not measure in all the same ways. There might be some variability in measuring as well
Yeah,
that may account for some of these more
absolutely.
unusual circumstances.
And there are people that are trying to do like whole person research, because we aren't just, what like a respiratory system or a, cardiovascular system. We're a whole system that's interacting all the time, with every other system. And doing, sometimes N of one research is a big thing now that people have wearables, and that's a whole nother, like way to look at personalized medicine. But we have to understand when we do a study, it's a very controlled population, first of all, and we're looking for a particular outcome, and then we translate that to what everybody. And so there's limitations to that as well of how we should be interpreting that. And I'm all for studying. I participated in doing some studies, and it has value, and uh I think when we can understand mechanisms of action of how certain things work, then it gives us some evidence and some validity to why we might introduce it in a certain person rather than looking for, oh, did that show that it, you know, cured XYZ in a randomized controlled trial, you know? So there's, again, how we think about, is there evidence, is there science, you know, before we implement something in patient care, we have to start changing that, you know, that the way we think about that.
Well, it's interesting because, as you know, serendipity is an incredible, powerful thing that we've experienced for, thousands of years. Of we thought that something was going to happen, and then something serendipitously occurred, and
Right,
then a different outcome came about than what you even expected. And by the way, now that's become the new normal. And
right.
so it's not always a randomized controlled trial.
Exactly,
It's a
right.
failure or a misstep that has taken us leaps and bounds.
Yeah. Yeah. And,
So,
you know, it's interesting because we have to also like you know, again, how did that work in a person? I know several doctors who there's this one doctor that I know that knew I did integrative things in Ayurveda, and I taught yoga and breathing and meditation and all these things. And we were kind of talking about vagal nerve, toning, and how a lot of yoga, that's why it has so many beneficial effects, and a lot of the breathing and things have stimulate the vagus nerve. But and then we were started talking about other integrative practices that are out there, and he said, oh yeah, he was an internist. He said, oh yeah, I just recently someone told me about this, tapping with EFT, tapping, which
hmm,
actually, again, especially in there's much more work on this in the behavioral health world because they understand trauma and the, sort of this fight or flight, you know, physiology. And so he said, yeah, so I have this patient who is anxious, and I told her to, do some of those things, and, and it really helped her. And he said, and sometimes I do. I mean, I don't know if there's actually anything to it, but, because it's almost like we feel like we have to say that, right? To like sound like I'm really a doctor, I'm really a scientist. Like we have to have a little disclaimer. And I was like, here you're telling me it's working, and you still have to say, well, I don't know if there's anything to it. I just found that really funny.
well, and it worked for his patient.
Yeah, exactly. And then, I don't know, it's just funny. I think it's so ingrained in us, right, to make sure we're using the science, and we're, and so I don't know. I just find that really interesting, and um, maybe that restricts us a little bit.
So, if someone is sitting here listening who is a physician who thinks, wow, I think I want to delve into this a little bit more. I think in one respect, I do agree with you. It should be in our medical training,
Hmm.
and that could treat the disparity that we have in our education, but
Hmm.
that doesn't affect the majority of us who are out practicing already. So folks who are already out in practice and they have interest in this, where do you suggest they get started?
Yeah, I think first, wherever you're inspired, I think, again, because there's whole systems. There's Chinese tradition, traditional Chinese medicine, there's Ayurveda, there's, even again, if you want to expand into functional medicine and other like kind of more in-depth lab testing, that's a whole nother field. So I think, that is very kind of biochemical, and if you're more inclined, I think you have to first find out what you're kind of passionate about, or what resonates with you, what makes sense to you. And then, there are all the vast certification programs out there. If somebody feels like they want to get a certification, there are definitely Ayurvedic uh, uh, educational, programs out there. Now they're starting like UCSF, the University of California in San Francisco. Part of their Osher Integrative Center. They have a physician-led training in Ayurveda that offers CME as well. And so, again, and then there's master's programs in Ayurveda, and then there's more traditional Ayurvedic practitioner programs that are going to be taught a little bit more traditionally. So it kind of depends. And then, of course, I teach in a certification program that really leans more into Ayurvedic lifestyle. Like, okay, maybe you just want to learn, what are the things I can teach people from, that body, mind, spirit kind of lifestyle perspective and bring it into my practice. I don't want to learn to be an Ayurvedic practitioner. I teach in the Gaja Chopra, like Ayurvedic health certification. So I think it really just depends on the level somebody wants to bring in. There are lots of great books now. You can look up books on Ayurveda 101 or Beginner's Guide to Ayurveda and just kind of start learning and then again explore, some of the different programs that are out there. And I will say that also you don't have to be an expert. You can read up on all these kind of new paradigms and different things that are, out there. And you yourself, even if you're not an expert, I just ask people just have an open mind, have an open mind and be curious and say, you know, I don't know much about that, but if you want to, maybe you should go see somebody who's trained in Ayurveda or, again, we do that. I'm not a physical therapist. I'm going to send someone to a physical therapist, and we do this like I'm not an acupuncturist, but I might recommend it to somebody. So just kind of think of that as this bigger bucket of referral, that instead of being sort of closed to it, and you don't have to be an expert and everything, but maybe that could even be a first step for some people is, just kind of start by being a little open. And then, as you said, if you're inspired, I think it just depends on how deeply and how much time you want to spend of your, precious time and resources. And then there's all kinds of programs out there. Yeah.
Well, and I think if it brings more meaning to your practice, maybe you're on the point of trying to decide, do you want to continue in medicine? And this might be something that kind of takes you back to your original why of
Yeah.
this is really why I went into medicine and this is where I'm at now. And maybe it can help bring you back closer to that why and maybe give a little bit more meaning than maybe what's currently going on. Do you think there's any particular little short snippets or things that people can add into? So like if I'm seeing a patient, I'm doing a history and physical, what couple of things do you think might be nice little pearls for me to be paying attention to?
So I do think, and what I found, and there's correlates in a different languaging of this nervous system overstimulation that we have, right? I think it's interrupting people's sleep. I think it's driving a lot of the anxiety, depression, a lot of mood issues. It's driving inflammation because we know when we're in fight or flight that signals the immune system to be more on alert, right? So I think that's a big driver, and in Ayurveda we call that a Vata imbalance. So I think again it doesn't have to be complicated, and people might not think of this as Ayurveda, but breathing, obviously, breath work is like my very favorite tool to teach people. So the first thing is to ask. I think at times in my practice and, like what I've heard from friends and family, and people don't always ask about sleep, right? I just co-wrote a book on the Ayurvedic perspective on sleep because there's so many tools out there to help us sleep and so many one size doesn't fit all, right? So trying to help people figure out what's interfering and what's creating your imbalance. But really just kind of focusing on breathing, like teach everybody a breathing technique. Uh, Looking at their food, and obviously it's a lot of the things we do already, but uh, regular schedules help. In fact, in sleep science, they're realizing that having a regular sleep wake cycle is more important than even the number of hours you get, and Ayurveda had taught this for a long time. Circadian rhythm, like chronobiology, when you do certain things is more important even than what you're doing. So, focusing on sleep, I always tell people do 5 to 10 minutes of slow rhythmic breathing before bed because it calms the nervous system and will give you better sleep. So you get a better day. Then wake up in the morning and look at the morning sun, for a few minutes, and that sets your circadian clock for the day. Eat your biggest meal at lunch. That's a biggie, and a light dinner, and try not to eat, after 6 or 7 p.m. So for cardiometabolic health, there's lots of research that supports that. And that's actually Ayurvedic, they say. So a lot of people will say, oh man, just when I moved my biggest meal of the day to lunchtime, that made a huge difference. So those are just some of the things. And then again, there's all different Ayurvedic practices. that you can do, for skin health and for respiratory health and eye health and, lots of different practices. But I think simple places to start are just getting people on a regular schedule of some time, of some kind. And everyone's life is different. So that's the other thing. You can't just, one size won't fit all. So I really try to meet people where they're at. But I think this nervous system overstimulation, constant sensory overload is getting everyone's nervous system really, um, we're all on hypervigilance stage all the time. So breathing is my favorite practice. And I tell people take breathing breaks throughout the day. Instead of letting your nervous system like get overloaded, so then it's really hard to sleep, just do a few minutes of breathing, every couple of hours throughout the day so that by the end of the day, you're not completely overstimulated. You kind of have modulated that throughout the day. That, is really helpful. And I do that myself.
That sounds like that would be something really important for us to be doing as we're seeing patients throughout the day. And
Yes, I
I mean, a
started
breathing break won't take very long. It's just a minute or two.
exactly. And I started years ago. I started taking just 3 deep breaths before I walked into every room. Like back in the day when we had charts, when I pulled the chart, when I pulled the chart, I would take 3 deep breaths. And now, like I'm in my office, and I'm like, okay, the next patient's in. Before I get out of my chair and go into the room, I take 3 deep breaths, and then, like again, that's a really great way to get present. So, that deep breath will get my nervous system calm. But then when you walk in the room, you're going to be more present with somebody too. So, um, yeah. And then I would
Right.
encourage people like learn about the different mind body types. And if people have, because most everybody has digestive issues and we can't be healthy if our gut isn't healthy. And there's so many great tips in Ayurveda. In fact, there's a GI doctor that I know here who has, kind of dabbled a little bit and I see on his reports, when he does colonoscopies and then sees people part of the plan, he'll always say like, do some knee to chest yoga poses and, eat warm cooked food. And he has like a couple of these Ayurvedic tips on there that he's just incorporated into his plans, and I'm like, I see you. That's Ayurveda. Yeah.
Those are all the little things we can do
Yeah.
that just
Yeah.
makes it better.
Yeah, absolutely. Yeah.
So as we wind this down, I usually close with my providers who are on here to share a funny story because I think that when the public sees us, and I think even sometimes a lot when our colleagues see us, they see us as very put together people and very tight. And and I think that there's a lot that happens in medicine that is just frankly hysterical that I really want our community to be able to laugh and share with, but also for those of us, maybe who are watching, who may not be in the healthcare realm, see some of the humor that we do. Anything stand out to you?
Oh man, that's a tough question. I love it though, because again, as you were saying this, and I'm thinking, it's so interesting, isn't it? And the behavioral health world and neuroscience confirms this for us that we tend to remember the bad things, right? Like we remember the negative experiences. And so part of what they tell us is when something positive happens or, potentially funny, that you should pause and like take it all in because it takes longer to imprint that memory than a negative one. So unfortunately, I like, I think funny. Yeah, that's a tough one. Uh, I think just maybe some of the things I've shared and uh, I think for me, it's really more, I think the heartwarming things, that like when patients say like, oh, thank you so much for listening to me, or um, I think rather than funny, because nothing really is popping out at me, I'll share one thing that is maybe a little more heartwarming. At least it really like kind of brought me to tears. So as I mentioned, I used to do ER and inpatient and all the things, right? And so of course, in medicine, you give someone, medication, you code them, or, they're in urosepsis and you give them meds or whatever it is. And they're like, oh, wow, thank you. You saved my life. And, like we always feel like, oh yeah, I saved someone today, and so that's always a good feeling. So then I stopped doing all of those things. Wasn't doing ER inpatient medicine anymore. I was just doing outpatient medicine. And I won't go into the whole story, but there was a woman that I saw that really, I think, highlights this concept of, body, mind, spirit. And she came in, she was type 1 diabetic and had run out of her meds, run out of her insulin. And so she, obviously acutely, I got her insulin, got her back on track, because you have to preserve the body first, right? And then I recognized she looked quite depressed. And I could have just said, like, okay, here's your insulin, now come back in 3 months and you're back on track. But I asked her, like, you seem kind of sad. And of course, she started crying. And so then we explored that. And then luckily I can do this in primary care. And then we stepped into more purpose. Like, as it turned out, she felt no purpose in the job she was in, and da da da. So all these things, I had this relationship with her over a year. And then her insurance changed. So that's not funny. That's kind of sad. And she couldn't see us anymore in this clinic. And I didn't know this. All of a sudden, she had written me a letter. And it was a letter of gratitude, and she said, thank you so much. It started out, thank you so much for saving my life. And it really stuck out to me, because, when I stopped doing all those all those other things, I thought, oh, sometimes that's kind of fun to like save someone's life, and like pull them from the jaws of death, right? And but to see that just what we do every day can save people's lives just by, helping them get back on track again. And like, yeah, it just really touched me. And so I guess maybe that's more of like a heartwarming thing than a funny thing. But I thought, okay, yeah, this is why I show up every day, and do what I do.
Yeah, I don't think you can undervalue a ripple effect,
Yeah.
because even just being present in that moment
Mhm.
can take it decades. And
Mhm.
you don't always get that front row seat to see what exactly that was, but it's still happening whether we're seeing it or not.
Yeah.
So,
Yeah.
well, Sheila, thank you so much for joining us today.
Yeah.
And I just want to talk to our listeners and just say, this conversation is really wonderful, because what Ayurveda is, it's not about rejection of modern medicine. It really is about an expansion of it. And I think that we have to remember, and thinking way, way, way back before, even as we were coming into medical school, healing is much more than protocols.
Hmm.
And I think that medicine has really shifted in that way, because we're trying to be efficient and we're trying to make sure we deliver the best care effectively, but also that we as physicians are part of that, and we're part of the healing process. And it maybe we need to go back, take a few steps back, and expand our view on that. So
Absolutely.
so you mentioned you have a book.
Yeah.
What's the name of the book, and where can people
It's
find it?
It's called Awakened Sleep. And it's based on this concept, like in Ayurveda, that, sleep is more than just, physical rest. Like, there's actually a lot of healing when we have natural restorative sleep. So it's called, and when we sleep well, we have awakened lives. So it's called Awakened Sleep. And it's available on all the booksellers. So wherever people want to buy, and audio as well. So yeah.
And
And
if
yeah.
if someone wanted to reach out to you and wanted to even maybe work with you,
Mhm.
what's the best way for people to get in touch with you?
So probably the best way is just, I have a website. It's www.drsheila.patel.com, and it's DR, no period. So DR and then SHEILA, spelled EILA. You have to spell my name right. So drsheila.patel.com. And there's a contact tab, and then there's a place where you can write a message. So, I've had people reach out and say, hey, I'm a doctor, and I'm really interested, if I speak somewhere or something, and they're like really interested in connecting. And then, you leave your email, and I always answer people back, on things like that. Sometimes I get a little behind, but I will answer back. So that's probably the best way, because you can leave a little message for me too there. Yeah.
Wonderful. Well, thank you so much for joining us today. And everyone, if you love this podcast, give us a thumbs up and subscribe and share this with all of your colleagues. You can find us also at soulfulsurgeon.com. We're also on Instagram and I'm also on LinkedIn. So if you have any topics that you want to talk about, please feel free to direct message me or contact us through the website. Thank you so much. And everyone, have a great day.
Thank you. Bye.
Thank you for joining me on the Soulful Surgeon podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.